Did you change group? What is your roll number? Roll number I will see now. It is serial number. These are all 1 to 6, 1 to 30. These are all under the group A, and 31 to 46 till now. These are under the group B, and rest around 14 students. They are under the group B. Okay. देखिए ना, in your mobile I share just what is the group A, B, C, A group and B group. Hello. Okay.
স্যার আমার নাম নেই তো, আই জে তে কেউ নেই, জে তে কেউ নেই তো,
তোর গ্রুপ বি তে আছে দেখ।
যার নাম নেই আমাকে হোয়াটসঅ্যাপ করে দেবে।
শেখ জিসান আছে দেখ 35 এ।
স্যার আমার নাম নেই।
লাস্টে 2-4 জন যারা ভর্তি হয়েছে 4 জন, তাদের নাম আসেনি আমার কাছে।
হ্যাঁ স্যার, সে গ্রুপে মেসেজ করব না,
আমাকে ডাইরেক্ট মেসেজ করে দাও, ওখান থেকে আমাকে পরে পাঠিয়ে দেবে, হয়তো পাঠিয়ে দেবে, কিন্তু তোমরা এই করে দাও, তাহলে আমি করে দিচ্ছি, ঠিক আছে?
ওকে স্যার, আমি করে দিচ্ছি।
কিন্তু তোমাদের আর গ্রুপ আর অন্য কোনো হবে না, তোমরা লাস্টে বি গ্রুপে সব চলে যাবে, যতজন অ্যাড হবে লাস্ট 14 স্টুডেন্ট ইন দা গ্রুপ বি, মানে ওদের আর অ্যালফাবেটিক্যালি এরকম থাকবে না, কিন্তু তারা হ্যাপাজারলি যে যখন আসবে দে আর অ্যাড ইন দা গ্রুপ বি। ওকে
ওকে
সো লেট আই
স্যার আরেকবার বলবেন?
বলো
স্যার আরেকবার বলবেন, ওই একটু পরে
কি বলছো বলো।
স্যার বলছি ওই গ্রুপে তো আমি গ্রুপ এ তে আছি, এবার কি প্র্যাকটিক্যাল কি হবে সেই বলছিলেন, আমি পরে জয়েন হয়েছি সেই জন্য শুনতে পাইনি।
কিছু হবে না, তোমার স্যার সব কিছুই বলে দেবে। Your teacher everything will be informed. Okay, just I create a group.
ঠিক আছে।
Class 8. Am I visible? Hello.
Yes sir.
Yes sir.
Okay. So introduction to social pharmacy. This is totally new topics in pharmacy profession. Before that there is a different subjects: pharmaceutics, pharmacognosy, anatomy, physiology, biochemistry, and human anatomy, physiology, pharmaceutical chemistry. But the social pharmacy is a totally new topics, new books incorporated into the pharmacy profession. Generally this subject which is in earlier they are incorporated into the mic off koro. Generally the subject is studied by the doctors and the nursing staff. Now the another medical person, the pharmacist, can read the social pharmacy. This is a very good correlation between the patient population and basic research and the market and authorization. So it's a good role of the pharmacist to the society, and that can help for the people and how to help them, and what are the way by the So this subject deals with the different topics related to today's class. This is the subject code. Be careful. Before that, this type of code is not available, but now it is in different types of code ER2015T. This code is you can mention in your theory and practice and theory classes also. So you can write down this code. The subject course code is the ER2015, but the scope. This course is designed to impart a basic knowledge of the public health. Basically, the public health epidemiology. That means all the like infection that are spread throughout the country. It is called epidemiology. Then the preventive care, how to prevent, how the infectious disease care, and the other social health related concept. Also, they emphasize the role of pharmacist in the public health program. So this is the scope of this subject. And what are the course objectives? That means from this course, what are the objectives of this course? Is the first one is the public health and national health program. Public health, basically local people are suffering from the different types of disease and disorders. That public can be helped by the medical professionals, and one of the pharmacists, which is generally the nurse and doctors, is directly related to public health, but still the pharmacy can attach with this health program. And different types of national health programs, which are already the WHO and the UNICEF and other health program, ICDS, so many Anganwadi, so many health program, health mission is to attach in a pharmacist. So these are the main objectives. And the another is the preventive of the healthcare. To prevention, suppose so many types of vaccination, vitamins, they are available, they get the associative or anti-inflammatory drugs for kill the enthalments. So these are types. This type of preventive healthcare can be taken by the pharmacist. And food nutrition related disease and issues. Nowadays, the some food which are help for the prevention of the some diseases and disorders, and simultaneously some foods that can causes the different types of disease and disorders. Say for example, like the fast food, junk food, can sugars that can be created, and the cold drinks, they produce the cancer. And in case of another food like oily foods and the lipid containing or high calorie foods, they produce the hyperlipidemia or produce a cardiac disease. So diabetes, cardiac disease, cancer, this type of disease related to foods, some foods causes. So what types of foods taken and what types of food not taken, that can be discussed with these chapters. Number 4, the health education and health promotion. Obviously, the health education, we are concerned about the health and how to maintain our health and what is the health. And obviously the health promotion, that means you cannot you can maintain your health, not your health. You promote the health for the other people or the society and the person. So health promotion, the health, that means not only the physical abnormality. Health means there is social and mental and socio-economical health, socio-economical status of this health. So general roles and the responsibility of the pharmacist in the public health. So generally the pharmacist in earlier, they are directly not related to the public health, but now you are attached with the public and you know what are the pharmacist and what are the roles. Okay, understood? Any queries? Hello? Any queries?
No, sir.
Okay, okay. Understood, I think. If any problem, please ask me. Hello? Without hesitation, just on your mic and
Okay,
speak.
sir.
Okay, sir.
Okay. But when you ask me, then you open, and after that you can off your mic. And what are the course outcomes? The successful completion of this course, the student will be able to, after the completion, you can knowledge from this social pharmacist, you have discussed about the roles of pharmacists in the various national health program. Number 1, after a completion of this course. Number 2, describe the various sorts of health hazards and disease prevention measure. So after the thorough knowledge of these subjects, what are the preventive measures? Say for nowadays, so many people, the rickets, blindness, and other diseases, how to prevent this? You can use the vitamins that can prevent this. So after the thorough knowledge of these subjects, you are preventing so many disease and disorders. What are the disease and disorders? And let us discuss the healthcare issues associated with the foods and nutrition, obviously, and describe the general role and responsibility of the pharmacist in the health. Okay, so these are the basic concept, basic idea of the social pharmacy of a pharmacist. So it's a new subject. I think it's a vast subject always, but you can take care thoroughly and read thoroughly, and you can understood time to time and chapter to chapter. I think you will be a good knowledge. Not only the good knowledge, you have a good citizen for the society, and you act as a, your permanent your specific role of the pharmacist to the society. I think then society can know the what is pharmacist, and then respect will be come from the society. I think it will be very helpful to and very great good feelings about the society, and you are a profit from the profession also. So these are the topics related to these chapters. First one, the introduction to social pharmacy and definition, scope, social pharmacy, discipline, the scope. Then pharmacy is the public health, concept of the health, food, definition, various dimension, determination, health, and national health policies, Indian respects, and public and private health in India. So it's a very big chapter. Okay, the national health policy. Just we can share with the knowledge and in your book also, and I also share as per the syllabus. Otherwise, the health mission. This is a 100 chapter books. So it's a very toughest. But what is the health promotion and what are the scope of improving the public health, and what are the concept of the who define the various dimension determination. So that are the health indicator also. So these are the national health policy. You can just remember the name of the health policy and what are the utility of this policy, not the what are the actual, because they are a good huge number of policies. So just you can try to remember the public and private health system, what are the system, what are the hospital, and what are the uses, and what are related to pharmacists and to the directly to the patient. And introduction to the Millennium Environmental Goals. So now the second chapter, the preventive healthcare role of pharmacists, and the following like demography and family planning. Nowadays this is the most burning issue. The number of people is running day by day, every day. So how it will be control the family planning and mothers and child health. This is very important. If the child will come, the mother's health as well as the child health is very important for the breastfeeding, effect in the infants, and meal substitute or the bottle. Nowadays these are the another issues, and overview of the vaccine, type of immunity, administrationization, effect of environment of the health, water pollution, importance of the safe drinking water, waterborne diseases, so many like typhoid, air pollution, noise pollution, sewage. So suppose you have created some company, there is some waste material, how to use this waste material and how to detoxify this waste material, and how this is the solid waste disposal systems and occupational illness. Suppose some worker who is working in the farmer, working in the different industry, say for example you're working in the coal tie or asbestos, this type of company, there is a chance of cancer. So there is occupational diseases. So you can how to prevent this. And environmental pollution, there is one of the major issues, the pollution nowadays. That's why the government can try to bring or to reduce the pollution due to the pharmaceuticals and psychosocial pharmacy, drug misuse, abuse, and psychotropy. So sometimes we are using drug for the treatment of and disease and disorder, but sometimes the misuse of the drugs, so or abuse of the drugs. So that type of measurement to be taken by the pharmacist, and social impact of these habits and the social health and productivity of the suicidal behaviors. So this can be, you can patient counseling directly, why they go to the suicidal behavior, and after that the counseling, they also help them and to understand what is the actual problem. Then after the counseling, they'll to prevent the suicidal tendency. Next, the nutritional and health, the basic nutrition. I think only give them macronutrient, micronutrient, importance of water and fibers, balanced diet, malnutrition, nutrition, so many topics related to. It is very important in present scenario. Okay. Number 4 chapters, this is the epidemiology and the pandemic situation. This introduction to epidemiology, the application, understanding the terms of epidemic, pandemic. This is the pandemic situation. That's why we are taking the class in this way. Endemic, mode of transmission, outbreak, quarantine, isolation, incubation period, contact tracing, morbidity, mortality, everything. I think all of you don't know it, and we time to time we are discussed thoroughly. So this epidemiology at that moment is very important because this is the pandemic situation and what the causative agents like epidemiology and clinical prevention and the role of pharmacist in educating the public health promotion. And the respiratory infection like chickenpox, measles, so many people are suffering from this disease and how to prevent, how to treatment this rubella, mumps, influenza, including the avian flu, H1N1, SRSA, SARS, severe acute respiratory syndrome, MRSA, COVID-19, diphtheria, whooping cough, acute respiratory. So I think it is a very good topics you can learn about thoroughly. You can help the society, not only the society, you can help yourself also and the relative also. Intestinal infection like poliomyelitis, viral hepatitis, cholera, acute diarrhea, disease, typhoid. So arthropod borne disease, dengue, malaria, filariasis, chikungunya, how to prevent and how to treat. And surface infection are trachoma, tetanus, leprosy, AIDS, sexually transmitted diseases, HIV or AIDS, human immunovirus or acquired immunodeficiency syndrome. And another last, the introduction to health system. I'm going in the national health program in India, their objective, function and outcome and the role of the pharmacist. And number 6, last one is the pharmacoeconomics, introduction, basic terminology, importance of the pharmacoeconomics. So after that, finally the study of the social pharmacy. What are the pharmacoeconomics? How it will be economized in the pharmacy profession? Obviously, your main target is to produce a drug or medicine in the cheaper way, and you can help for the society, and that can help society, all the people, poor as well as the poor people also. That is our main mission, to get the medicine to all of the society peoples, not the richer person, but the poor people can or then can use this drug. So these are the main objectives of the pharmacoeconomics. So these are the 6 topics, but under these 6 topics, so many topics, subtopics. So time to time we are discussing with Mr. Deepak Kumar Singh. Another is my colleague Orgha Bhattacharya to share these subjects. And first topic I can cover, and second is Orgha, then we discuss and time to time. Okay. So these are the fundamental science and social pharmacy with the fundamental science, social pharmacy, a correlation between the 3 things. One is the fundamental science. Obviously, you know the fundamental science, and the social science and clinical science, ultimately the social pharmacy. So these are the 3 topics, 3 science, and then get the social pharmacy. Okay. So we go directly. Understood? Hello?
Yes, sir.
Okay. I think these are discussed with them. Pharmaceutics class. So last class we discussed about that the term is the pharmacy have been derived, the word the pharmacopoeia is the means is the use of drugs, use of drug. Okay, the pharmacy, and the pharmacy is a branch of pharmacology, branch of actual pharmacy that deals with the collection, preparation, standardization, compounding, dispensing of the drug in such a way so that to make a medicine is suitable to easy, effective and palatable administration in the treatment of diseases. Okay, so these are the pharmacy, these are the old pharmacy, but this is the clinical pharmacy. They are the newer concept. The pharmacist go to the doctors, the patient go to the pharmacist, and they can counseling them. After that, the appropriate choice of the drug can be done by the clinical pharmacist. So newer concept. And the pharmacognosy, this is the study of source and identification of the drug from the plant source. not biopharmaceutics in your syllabus. And medicinal chemistry and pharmaceutics, it is the technology science which deals with the manufacturing of the drugs. That means all types of preparation like tablet, capsule, injection, aerosol, ointment, cream, cold cream, vanishing cream, so many preparation. Both the drugs as well as the cosmetics can be prepared in the pharmaceutics. So we take care about these subjects and knowledge and practical also. If any sort of problems, field problem, please inform me. And the pharmaceutical preparation in the form of drug prepared in the dispensing of the patient also. These are the main motto of the pharmaceutics. The drugs, it is the substance and the product that you should intended to use to modify or explore the physiological systems and pathological state for which the benefit of the recipients. This is the as per the WHO 1966. But the recent definition of the drug are the, write down this, drug are the substances that can alter any physiological changes. Drug are the substances that are used to alter any physiological changes is called drug. But in your forensic pharmacy, drug are the substances that are used for the treatment, mitigation, prevention and cure of the diseases. Even the diagnosis of the diseases is called the drugs. But the recent topic, the most modern definition of the drug is the substances that can alter any physiological changes. Kono rokom body jodi change hoy, that is called the drug. And what is the dosage form? Different types of drug in the form of dose like tablet, capsule. Suppose say for paracetamol powder, 1 quintal. When it is dispensed in the form of tablet or injection, it is called the dosage form. They are the convenient form of the natural as well as the synthetic drugs from the administration into the body of the patient. That is called the dosage form. Or the good drug that not directly administered, they are in the form of different dosage form like tablet, capsule. It will easy to administer and it is in the certain dose. Otherwise, you cannot dose cannot be measured. There is a chance of toxic effect or adverse effect. So dosage form is very important, and that dosage form can be created by the pharmacist. So we take care about these subjects. And drug nomenclature, different types of naming system of the drug, like chemical name by the I think you study in the pharmaceutical chemistry, non-proprietary name. That means it is the short name given from the drug that is not subject to proprietary rights. Proprietary rights, that means no property rights of this particular drug. That is called the non-proprietary name. Another is the brand name. And the approved name and the official name, they are name which is published in the official books, and that there are two classes. One is the approved name. The name is given by the bodies like the United States Adopted Names Council like USAN, and the British approved name BAN soon after the introduction. And this name is something refers to the generic name also or approved name. So sometimes you are hearing the generic medicine because this approved name is called the generic medicine. And they're designated as a chemical and the pharmacological drugs of the such as penicillin. But this penicillin or amoxicillin, which is given in the different drug in the different brand name also, the one Clavum and so penicillin group of drugs or benzyl penicillin. The official name, the name is approved by the National Pharmacopoeia Mission and introduced in the official book or the pharmacopoeia. And be remembered about what is the spelling of the pharmacopoeia: IP, Indian Pharmacopoeia; BP, British Pharmacopoeia; USP, United States of Pharmacopoeia; and NF, National Formulary. And be careful the pharmacopoeia spelling. Next, PO, at a spelling mistake. There is a mistake. You can write down PHARMACOPOEIA, pharmacopoeia. The official name of this can be done. And the proprietary name, this is called the brand name, the name designated by the trademarks or by the company. One drug can be multiple by the proprietary name also. For example, the chemical names for hydroxyphenyl acetamide, non-proprietary name. Approved name in the British by the paracetamol. United States approved name acetaminophen, an official name acetaminophen, and proprietary name the crocin, calpol, metacin. Okay. Do you understand the competence and pharmacopoeia? Thank you. And next, I go through the another slides. health. Be careful, write down this. Health is a state of complete physical, mental, social well-being and not merely the absence of the disease or the infirmity. Health means, that means in your body is good and feelings good, that means health. It is not true. Health means you are physically fit. Health means you are physiologically is okay. Simultaneously your mentally is okay, that is called the mental health. And obviously the social, sometimes they are physically fit, mentally fit, but the social condition, their environment can torture or may feel some problems. So in that case there is a not good health. So three things: one is the physically fit, mentally, as well as the social. Another is the socio-economical. Not only the social, so social behavior okay, mental behavior okay, but physically you are okay, but the economical condition is sometimes problem. That is another problem issue to create a mental problems, and mental problems that create a physical problems. All are related. So social to economical and socio-economical factor, one of the major issues nowadays for mental issues. Suppose you are a students, or you are trying to student credit card, but you are not getting the student credit card. So it's a one problem. So from these mental issues, you are a mental patient, then you are a physical problem. So mental to physical. So all these related to health. Understood? Hello?
Yes, sir.
Okay. So here
Yes,
again, you are before that, I think health means you are physically fit. This is not true. You are physically, mentally, social, and socio-economically fit. Then your health is good. Health is okay. Okay.
Okay.
Okay. The spectrum of health, like ideal health, positive health, negative or marginal health, in parent disease, parent apparent disease, and death. So these are the ideal health that conforms to the WHO defined as per the health definition. Next is the positive health, the perfect continuing the adjustment between the individual and the environment. That is called the positive. So your individual effect and the environment. This definition indicates that health is a positive dynamic interaction between the individual and his surroundings. Not you are good, you are feeling good, you are physically fit, but your surroundings is not good. Say for environmental is polluted, that means there is some problem. Your neighbor, they create some problems. So in that case also you are feeling sort of problems. So these are the individual and his surroundings with a proper acclimatization, adaptation to the maintain of the health. Understood? This is called the positive health. That means your and your surroundings. If it is okay, then it is called the positive health. Understood? No.
Yes, sir.
Yes, sir. 5 minutes. Negative or marginal health. It is the individual. It is the state of equilibrium to looks healthy, but he has not able to adjust the himself to his to his surroundings. So that's a problem. You are okay, but your surroundings not each okay. Suppose you are a student. In the CAPD college, in your home, it is quite okay. But when you admit in the college and you say the hospitals or in the mess, there is some problem or you not adjusted. So there is another mental issues. Then he is going to fall ill on slightest or adverse stimulus, due to the adverse stimulus. So this is called the negative or marginal health. Understood? Suppose you are good in your home, it will become perfect. But when you come to the college, in college environment or in the stay in the hostels or in the mess, there is some environmental problem or there is some students, some other seniors, there is created a problem. That is also negative or marginal. There is some problems created by the others. So this is not your problem, but this is problem by the others or created by the others. That is called negative health. Okay.
Yes, sir.
Next, inappropriate diseases. Disease, another disease. Disease, so many times I talking with you, the disease and the disorder. You can write down this. Disease are the condition that is caused by the pathogenic microorganisms. That means disease caused by the pathogenic microorganisms. That means some pathogens like bacteria, virus, fungus, and any others that causes the disease. Okay, so disease is a state of the departure from the normal to the extent that are the ordinarily physiological process of the tissue and organ are not enough to restore the body to the normal function. An apparent disease, that means the preclinical. It is not the disease, just the preclinical conditions. It is not recognized by the individual, but can be discovered by the examination or screening test. Say for example, suppose one person is suffering from the cancer, but cancer, when they are detected of the cancer, actually the cancer is not created at that day. The cancer is created in the very 1 year or 2 years before. That is called the pre-apparent or the apparent, inapparent or the preclinical state. When you take different types of testing and screening, say that's why we are talking, we are advice for the people above age of the 40. We are regularly check every 6-month interval your lipid profile, your liver function test, kidney function test, even different types of markers in. So these are the screening procedure by which you can easily understood or earlier understood, or this is called the earlier marker for the different types of disease and the disorders. Okay, so that is like a cancer when it is examined, confirmed. Actually, this cancer is not created in that day. Just say for example, another disease like the hyperacidity or acidity. So the one it is an acute problem, but the cancer is not created at that day. It is created the 1 or 2 hours before. Okay, after that the cancer will be calm. Understood? Apparent disease. There is an individual in this awards that he or she is suffering from the illness, whether he or she seeks in the medical care or not. Epidemiology, AP, ons and derms means people. So epidemiology is the subject concerned with the study of that happens to the people with the involved in the disease, whether the communicable and sometimes non-communicable. What is communicable disease? Communicable disease, those are disease which are infected from one to others. That means spreadability. But non-communicable disease not are spread to the others. It is the defined that study of distribution, frequency, determinant, dynamics of the disease in the human population. Okay, so this is the epidemiology. That means some communicable disease and some non-communicable disease which is spread throughout the society or throughout the area, locality, or throughout the state or country or throughout the world. That is called the epidemiology. Under this, different are the factors affecting the occurrence of the disease. Like human beings is the main host factors. Another is environment and causative agent. These are the three factors: human beings, environment, and causative agents. Causative agent which is attack to the human being, then human beings spread to the environment. Say for example in the COVID-19, I think you can. So that's why government can announce the lockdown of this whole of the world. Whole the different country also they order it, but the whole of the world they are in lockdown because they are there to prevent the spreadability of the diseases due to the environment, to stop the environmental changes, because this causative agent here is the coronavirus. It is spread to the human beings, and this one man is infected, then it will be spread to the others. If you do not contact or nearest to the people, then there is no chance of contamination. That's why this lockdown and quarantine. So these are the three factors. One is the causative agent, that means the bacteria, virus, fungus, and then effect on the human beings, and then spread to the environment. Ultimately, the environment can spread to the other peoples, and finally, the whole community can be spread. Okay. Hello. The host factor, that means human factors. What are the factors? Like hereditary and genetic factors, their age, their sex, and their health status, prevention of the immunological expression, physiological state, lifestyle, like smoking, and socio-economical status. These are the conditions. In case of socio-economical status, so খুবই খারাপ অবস্থা, in that case কি হবে? সে বাইরে বেরোবে, যতই বাধা দিক না সরকার, তাহলেও সে কিন্তু বাইরে যাবে, সেখানে তার মানে সে কিন্তু স্প্রেড করার চান্স রইল। পরে আমরা ডিটেলস বলবো। এনভায়রনমেন্টাল ফ্যাক্টরস লাইক দ্য ফিজিক্যাল এনভায়রনমেন্ট, বায়োলজিক্যাল এনভায়রনমেন্ট, সোশ্যাল অ্যান্ড কালচারাল এনভায়রনমেন্ট, any other environments that can spread the diseases. So, disease causes and epidemiology thought the agents, the type, dose, and the virulence, and the host, environment, age, sex, and genetic, and the temperature, humidity. Okay. So these are the causative agents and risk factor for the etiological factors. No one known etiology, the host, environment, and I say, so these are the different simple diseases causes and multiple risks. One simple disease, these are the factors and the disease. The microbacterium causes the TB, tuberculosis. The factors A or the factors B and factor C. That means 1, 2, 3 C that causes the diseases. The hereditary, the hormones, obesity that causes the cancer in the breast. And the factors 1, B and C that causes disease like atherosclerosis due to the hyperlipidemia, hypertension, and personality type like ischemic heart disease. So these are the different types of causes that causes the ischemic heart disease, the congestive heart failure. This is the ischemia means these are the ischemic heart disease. These are the cancer in the breast, these are the hereditary, hormone, and obesity, and these are the different types of factors that can help, that can causes the diseases. So causative agents like biological agent, nutrition agent, chemical agent, for example, poison, insecticides, are environment. Physical agent like exponential good, electricity, radiation, mechanical like causing injuries and accident, metabolic agents like phenylketonuria, galactosiria, genetic agent like a Down syndrome, and functional. These are the details in the discussion. The risk factors, these are the factors made of the individuals and family, individual, community also. So these causative agents may cause known as a known or unknown. The risk factor are related to the host and his or her specific environment. And these are the public health is the that are the art and science that promoting the health, preventing disease, increasing the span of the healthy lives through the organized factors in the society. Another definition of the public health, not mentioned here, just essential public health function: protection of the environment first. Number 2, health education, health legislation and health regulation, prevention and control of the communicable diseases, care for the specific group and mothers, children, and works in the certain hazardous occupation. So these are the another factors, and assessment of the health needs plan. So these are the essential health mission and public health. Later on we are discuss more elaborately. Community health, community medicine, we can help for the community. It is the application of the principle of the health or the community, and community is a group of individuals sharing with the identity, culture, operates through the common institution and organization. A health center is a rural or a urban area in responsible for the health of community. They are served within their catchment area. So these are the community. Actually, they are the basic function of the pharmacist to communities, to serve the community, and community medicine also. And preventive medicine, these are the science and arts that application of different types of disease for prevention of population, community, and individual levels. That is called the preventive medicine. So these are, say for example, vitamins which are used as a preventive medicine for the population, community, and individual levels. Yeah, I think you can know the chart. The suppose vitamin A for night blindness, vitamin D for rickettsia and osteomalacia, vitamin calcium for rickettsia, vitamin C for scurvy. So these are all preventive medicine. And the pattern of the cares like preventive care or curative care, sometimes we are using some drugs to prevent the diseases, and sometimes for curative, that means therapeutic. When the disease is occurred after that uses, that is called the curative. That is preventive, to prevent the disease or disorder, that is called the preventive care. Level of the prevention: primary prevention by the health promotion and specific prevention; secondary, the early detection of the disease and promote an appropriate treatment; and tertiary, rehabilitation. These are the level of and pattern of the curativity, like emergency care, sometimes the emergency is needed, and emergency episode care, continuous care, and terminal care. Okay, next. So these are the medicine and community medicine, like objective the patient, curative the health improvement, information, investigation, diagnosis, resources, management, evaluation. Okay. Okay, thank you very much. I think all of you listen and what are the basic motto of the social pharmacy, and next day we details go through the chapter by chapter and topic to topic. Okay, thank you very much. I think all of you understood. If you not understood, please write your chat box or in my Google Classroom. I can upload this class in your Google Classroom. Okay, thank you.
Okay.
All.
Thank you, sir.
Thank you, sir.
Thank you, sir.
Any queries?
Thank you,
No
sir.
queries. No, sir.
স্যার বলছি আমাদের ফোর্থ পিরিয়ডটা কি বন্ধ থাকবে?
দাদা ওই কোয়ারি কোশ্চেন অ্যান্সার বলি, তারপরে
হ্যাঁ স্যার সেটা
ফোর্থ পিরিয়ডে কি আছে?
ইয়ে ক্লাস টেস্ট।
ক্লাস টেস্টে তো বন্ধ থাকে, ক্লাসই হলো না তো টেস্ট হবে কি করে?
হ্যাঁ
এরপরে ক্লাস ফোর্থ পিরিয়ডে আমি